Ladies and gentlemen, dear friends, colleagues, it's a great pleasure to be with you again today in a second press conference. I think it's number 25 or 35. I lost counts. And unfortunately, every week or every second week we come to this conference, we always hope to come with better and good news. And there's always a light at the end of the tunnel. And as usual, I will start with the numbers. The number of confirmed cases registered in Oman yesterday was 1,453, and the total number of confirmed cases in Oman as of today, 281,688 cases. Those who were admitted yesterday to all healthcare facilities in Oman were 134 patients. The total in our healthcare facilities today, 953 patients. 16 of those patients were admitted directly to the intensive care units. And the number of cases in intensive care units today is 494. Those who passed away, rahmatullah alayhum jami'an, 15, and the total is 3,371. Which means the percentage of those who died from the cases is about 1.2 in Oman, which is still below the international average. The number of doses of vaccines we've received up till yesterday, 1,936,330 doses. And the number of doses given to different healthcare facilities in Oman to be administered, 1,518,864. Unfortunately, those who were entered in our application, Tarassad Plus, is only 1,266,293. And that gives the total of those who are already registered being vaccinated to 36% of the target of the population in Oman. As it's been mentioned in the last conference, and as you've been following, unfortunately, this pandemic is still here, worldwide. And the numbers in 4 of the WHO 6 regions, as mentioned by my colleague Dr. Ahmed Al-Mandari, the regional director of WHO for the Eastern Mediterranean region, 4 regions of 6, the numbers are still rising. This virus is similar to many viruses in the past that caused pandemics. It is changing all the time, the mutation. And at the moment, confirmed, more than 98 countries are affected by what's called the Delta strain or type, which was discovered initially in India. But it's managed to spread to at least 98 countries. These are the countries which reported they have the ability to report and to do the sequencing of the genetic of the virus. There have been lots of questions about vaccination and why Oman was lagging behind some countries. Unfortunately, worldwide, there are 3 billion people who received at least the first dose. But many countries, as yet, they have not covered 1% of their population. We managed, thanks to the effort of everybody, to cover 36% at least, and we aim by the end of August to reach more than 55% of the targeted population. The number is about 70%, but to be on the safe side, I say 55% plus. We booked over we booked over 7,600,000 doses of vaccines. Hopefully, all of them will arrive before the end of the year, and that will be enough to cover about 3.4 to 3.5% of the population, and that's our target. But let me remind everybody, vaccine is only one of the tools to protect ourselves, our families, our communities from this disease. The other tools are valid. We know they've been tried and working, and we need to stick to them. When you are vaccinated, yes, the vaccine will protect you from the severity of the disease and reduce the risk of death. But it does not stop you from carrying the virus and spreading it to others. It doesn't also protect you 100% from having the disease. We have cases like many other countries in the world, people who had 2 doses and they had the vaccine, but luckily they were mild cases. So please, I'm urging all of you to continue following the public health advices that you all know. Other questions also come, whether directly or through the social media or the media. What's the point of partial lockdown? What's the point? Why are you even making it more severe? We and all other countries actually who tried these methods, we have the evidence that partial lockdown, even partial for a few hours, it does make a difference. I showed a graph when I was talking in Arabic. I don't know whether it can be shown now. Most of our surge of our cases happened after event, like the Eid holidays. It happened in last Eid, last year. Our numbers were very comfortable, and suddenly, and we know the reason, the numbers surged. Again, during Ramadan, we had partial lockdown. The numbers were stable, coming down, and suddenly after Eid, and we know what happened during Eid and after Eid. Gathering, not wearing masks, hugging and kissing, and all these things shown in the social media, so the numbers surged again. We started the partial lockdown, and luckily our number over the last 2 days stabilized, and the curve started to come down. But we need to keep these numbers coming down. The vaccination program is going very well, and I thank all of you for going to the vaccination center if you are from those who are targeted to be vaccinated, and for keeping the public health advices by social distance, or physical or social. I prefer physical instead of social distancing, physical distancing, hand hygiene, and the mask. These measures do work. It's probably our first time to have a 3 days complete lockdown. I have here representatives from different sectors, including the Royal Oman Police, and I can assure all of you that emergencies and humanitarian and human needs will never be stopped. There will be basically a center where all the sectors are represented, and the number to call is, Lua Abdullah, 1099? Yes, 1099. And for any questions about what is allowed, what's not allowed. But unless we work together again, unless we continue to look after ourselves, our families, the communities, unfortunately, the cases will continue to escalate. I wish you all well, and please remember that our healthcare system was very solid and continued to be solid. I'm grateful to all my colleagues working in the system, but there is a limit. When we start with less than 148 intensive care beds in the country, and we reached more than 530 ICU patients for one disease only, COVID-19, that tells you, firstly, about the severity of the disease, secondly, about the amount of work that has been done by the health sector over the last 18 months. The staff, whether from all healthcare facilities, whether government or private, they've been non-stop for 18 months. So please, if you take care of yourself, remember, you'll save our National Health Service. You'll give a relief to our staff in these facilities, in addition, of course, of your own benefits of not becoming sick or passing the disease to others. I wish you all well, and Eid Mubarak for you if we don't meet before Eid.